Today, we're going to talk about nutrients, different supplements that really help with fat mobilization and muscle preservation. We are super excited about this topic. It's kind of been like our baby for the last 11 years and really digging deep into the science of weight loss so that, we can help our patients being, a weight loss business. So a little bit about us. So Erica and I are co-creators of Weighless RDs. And really, Weighless RDs, we came together because we saw that there was a huge disconnect and a huge need for a new approach to weight management. And our goal and our mission is really to unite dietitians and functional nutritionists to reshape the future of weight management. Dietitians, nutritionists, we are the experts. We are the ones that are going to drive change in this chronic disease and obesity pandemic. And so we're going to be talking about a lot of different things, but I really want to just reinforce the fact that, there are millions and millions of people talking about weight loss and what people need to be doing for weight loss. And so when you really take a step back and think about it, I mean, we are the professionals that should be driving this. Dietitians are critical players in weight loss. I do think I still think some of us are still caught up in the idea that if we just kind of improved our diet and we exercised more, everything would be fine. So we're going to kind of clear up some things there as we continuously do, because we do these webinars often. But weight loss in general, weight loss resistance is multifactorial. I think most people understand this. But at the end of the day, we have to get the body into a healthier metabolic state. So we have to look at this functionally. We have to look at root cause issues. Precision care and addressing underlying imbalances in the body is really what's going to move the patient along the spectrum. And we're going to reiterate some topics as we go through, but really important pieces as it relates to, again, getting patients results and keeping the weight off. So just a little bit about Weighless MD, Weighless MD is my weight loss and wellness business that I opened in 2015. And I am the only medical weight loss business owned by a registered dietitian nutritionist. So again, we approach things very differently. Obviously, the training is food and nutrition, so that is the foundation. Digging deeper into how the body works. So identifying root issues is just paramount to weight loss. And so like I said, for the last 11 years, we've been researching, creating, doing our own studies, and coming up with different programs for our patients. We have a team of dietitians. We have other practitioners in the business as well. But we have trained dietitians on our weight loss programs for many years. And there's certain things that we found to be really, really beneficial in working with dietitians that we'll talk about. And the foundation really for the creation of Weighless RDs has been Weighless MD. So I know it's kind of probably a little confusing, but it's pretty similar. But Weighless RDs is basically an entity of Weighless MD because we are now changing our focus from patient going, working solely with patients to now working with practitioners, professionals, dietitians such as yourself, so that we can expand and really help educate on some of the things that we've learned over the years. So let's talk a little bit about the current weight loss environment. And we all know this. I mean, it is the wild, wild west. There's so many people talking about different weight loss, what works, what doesn't. Most options available do not address the problem. They just don't address the problem. And therefore, if you don't address the core problem, weight loss is short term. And that's why study after study shows that, more than 90% of people regain their weight after they lose. There's so many different fads out there, misinformation. People are they're desperate. So they do desperate things. They hear something that works, it's a miracle, and they're trying it. So it's kind of a mess out there. And even amongst the experts, we all kind of have our own approach and our own way of doing things. And, you hear the gamut of it all, exercise is necessary. What type of diet? Low carb, low fat, there's so many different things out there. And one of the main things is that, our patients are are shame. They have shame, they feel shame because at this point, I mean, we hear it on a regular basis. People come to us because they have tried everything and they can no longer lose weight. And there is a large portion of people so if they're seeing a doctor or seeing other practitioners, when they go in and say to their doctor that they've tried everything and they eat well and they exercise, they don't believe them. But for the most part, like, they're telling the truth. It's that we're just not treating the real issues. So therefore, people are going to do this all day long and they just can't get results. And then if you think about us as practitioners, and we're talking about this all the time amongst our team, we're shamed because we can't help people. And if you are in a situation where you're stuck with, in a place with patients because you can't get them to lose weight or you can't move the needle, that's a reflection on us. So again, it's kind of a little crazy out there, but that's why we really wanted to create this platform, because we just feel like the power is in the number. And we know what we know, but we know that we can do so much more, as a collective group. So the learning objectives for today is we're going to discuss why your patients can't lose weight. We're going to talk about different fat stores in the body that respond differently to weight loss. We're going to discuss the mitochondria and how it plays a role in fat loss. We'll dig deeper into the science of visceral fat, learn about supplements, nutrients that can target resistant fat, and then we will introduce our metabolic weight loss programs that we offer, and then an offering that we think will be really beneficial for practitioners. So weight loss is multifactorial. We always start out with this because if you don't understand this concept, then it will just be really difficult if you are working in this area. It starts with the standard American diet. It's just terrible, and that kind of creates havoc in the body. So it affects people's sleep and stress. The toxicity that surround us, it plays such a huge role in weight loss. The hormone imbalances, mental health, nutrient deficiencies, gut health, body composition. So there's so many different things. So what we decided early on is we just really wanted to get to more of like the root. Let's go deep so that we can we can give the body what it needs so that it can start to heal itself and you don't chase, every symptom and every ailment. So I'm going to start out with just reviewing fat cells. So there are three main adipocytes in our body. Okay, so we have white adipose tissue, brown adipose tissue, and beige adipose tissue. So you can kind of see from the image that they look pretty different. But just to give a summary of each one, white adipose tissue can be subcutaneous fat. It can also be visceral fat or ectopic fat, fat that's elsewhere in the body. And the morphology of it is that it's more spherical. So you can kind of see it's more round, and it has one single lipid droplet. And it has very few mitochondria within the cell. So the main function of white adipose tissue is to store energy. And then you have your brown adipose tissue. So this is fat cells that are all in different areas of the body. They are smaller, there's more of them, and they're smaller lipid droplets, and they have a large number of mitochondria, which I'll show some images in a couple slides. And the main role is for expending energy. It's for creating heat in the body. So the more brown adipose tissue you have, the more energy you're going to use and burn. And then you have your beige adipose tissue. So these are fat cells that are somewhat neutral, but they have the ability to convert into white or to brown. So this is something that would happen, we hear about the thermogenic potential through like cryotherapy, or fasting or HIIT exercises. So it's those types of stimuli that can actually convert like beige adipose tissue into brown. Or if you're sedentary and you're eating the standard American diet, your beige adipose tissue can convert to white. So it can kind of go in different directions. But again, this is just a summary of the three different type of fat cells that we have in our body. The fat cell dynamics as we age. So the total number of fat cells they basically stabilize in adulthood. So if you are going to continue to gain weight, what would happen is the cells will actually grow in size. If you lose weight, the cells will actually shrink. So it has the ability to do that. Now, what can happen is you can actually replicate fat cells. It's called hyperplasia, and you can grow the number of fat cells at any age. And that's not necessarily a bad thing. So again, just to kind of bring us back, so hyperplasia is increasing the number of fat cells, and hypertrophy is a fat cell growing in size. So again, the number kind of stabilizes, and then you have the ability to grow a fat cell or shrink it, but there is some opportunity for hyperplasia in certain situations. With age, fat shifts to different areas of the body. This is, usually due to hormones or metabolic changes. Metabolic health. So it is estimated that, 98% now of Americans have some type of metabolic dysfunction. Obviously there's varying degrees of metabolic dysfunction, but the more metabolically compromised we get, the more dysfunctional our fat cells are. So, as you can imagine, the majority of people now, they not only have excess fat, but now the fat cells are very dysfunctional and metabolically, compromised. So just another image, a closer up image of the white cell versus the brown fat cell. So white, again, large lipid droplet. Here's the mitochondria, not many mitochondria. And again, it's for storing energy. And then you have the brown fat, which has multiple mitochondria and has smaller lipid droplets. So this is a healthier fat cell. And then the image to the right is just kind of showing you that these fat cells can convert into the healthier or the unhealthy cells dependent on your lifestyle, diet, and things like that. Okay, so I'm going to now talk a little bit about the mitochondria. So the mitochondria is in every cell, multiple mitochondria in every cell of our body. It is the kind of like the furnace of the cell. So it produces the energy, or ATP. It regulates metabolism. It helps detoxify the body. It helps detoxify ammonia in the liver. It helps build components of blood and hormones. It's involved in various cellular activity signaling and cell growth. And it is involved in lipogenesis, lipolysis, and fatty acid oxidation. So it plays a huge role in fat metabolism. All right, so a couple of these slides are pretty busy, but I'm gonna I just think they're really important to bring us all to like a baseline of understanding of fats because fat metabolism is actually super complicated. And this is just like touching on some of the bigger, more simplified concepts. But essentially, how fatty acids, so fat has to enter the mitochondria in order for it to be used for energy. It's as simple as that. And so basically what happens, there's a need, your body identifies, not enough energy coming in. And if I haven't said it, this is the science behind it. So this happens in a healthy state, right? So even though what I'm saying right now is in a healthy state, but this doesn't happen anymore because of the dysfunction that we have in our body. But this is what's supposed to happen. So there's a need for food. So hormones trigger fat cells to be released. And so triglycerides are released and broken down into glycerol and free fatty acids. These free fatty acids are released and they travel all through the blood to all different parts of the body. And then the cells that need the fat will take it up. So these fatty acids will enter these target cells via transporter protein, so they get in it pretty freely. And once they're in the cell, the cytoplasm of the cell, they will attach to an enzyme, coenzyme A. And the fatty acid plus the coenzyme creates the acyl-CoA. So probably learned this from, I was telling Erica that I remember hearing this in my like junior year at college. But anyway, bringing it back around. So it attaches to this coenzyme A, and the fatty acyl-CoA cannot enter the mitochondria, okay, where it needs to be used for energy. So that's where the carnitine shuttle, the carnitine comes into play. So carnitine comes in, attaches to the acyl-CoA, and now it's able to get into the mitochondria. In the mitochondria is where beta oxidation happens. So fatty acyl-CoA is broken down into two acyl acetyl-CoA compounds, and now it's actually able to enter the citric cycle in order to produce ATP and be used for energy. So we're going to kind of come back to this, but you can just see that there's many things that could go wrong in order for your body to actually utilize its own fat stores. So the mitochondria is super duper important. And the majority of people walking around have so much mitochondria dysfunction. It could be from the environment, it could be from the food, metabolic disorders, nutrient deficiencies, infections, just aging, autoimmune conditions. All these medications cause so much mitochondria dysfunction. Statins are one of the big ones. So, again, that's just another thing that is affecting people's ability to burn fat. Signs of mitochondria dysfunction, there's a lot. These are just some of them you can kind of read through, but for me, when I am talking to someone and, you kind of get the full picture, but anyone has low energy, just tired all the time, muscle weakness, usually there's a good chance that, there's mitochondria dysfunction. Neurological issues, muscle and joint pain is pretty significant. Gastrointestinal problems, heart problems, respiratory problems, etc. So again, the symptoms can be, the issues can be pretty widespread. So as you can imagine, with all of this mitochondrial damage, this is going to hinder one's ability to lose weight because it can't use its own fat stores. It can't convert fatty acids into energy. So the mitochondria, you have a reduced fat burning because the mitochondria are responsible for that. Slower metabolism, so it makes it harder for the body to convert food into usable energy. So it increases your fat storage rather than fat burning. The mitochondria, there's mitochondria fragmentation that can happen. And this is basically what this is the mitochondria and the fat cells begin to break apart. And so they're not as viable, they're not as healthy, so they're not efficiently burning energy. So it really does create this impaired energy balance. And so if you're not burning, then what are you doing? You're storing. And when you have mitochondria issues, it this damage disproportionately affects visceral fat, because visceral fat, which we're going to get into, already can't get into the mitochondria for multiple reasons. All right. So let's just kind of summarize, because that was kind of a lot of information. All right, we talked about the different fat cells, kind of got an idea of what that looked like. The importance of mitochondria for health for fat metabolism. And now we're going to talk about visceral fat and why visceral fat cannot enter the mitochondria effectively. So in order for well, let me just take a step back. Okay, visceral fat is from two main things. So it's from excess energy. So, people are eating too much food. And not only are they eating too much food, the food is terrible. It's not real food anymore. So it's causing all of these other issues, blood sugar dysregulation. They add sugar to everything nowadays. This blood sugar dysregulation that is happening for years and years and years eventually results in insulin dysregulation or hyperinsulinemia, etc. So these two components here are going to be the drivers of visceral fat. So when you have adequate, and it doesn't even have to be like excess amounts of energy, it has to be just adequate amounts of energy. And this higher insulin levels, the sugar in the blood cannot be removed at the rate that it needs to. So what is happening in the body is the body has a mechanism to get sugar out if insulin can no longer get sugar out. And what it does is it converts the sugar into triglycerides, so lipogenesis. So it converts it into converts it into fats. And these fats, remember, now are the dysfunctional fat because they're larger and they are the larger they are, the less metabolic, the less healthy. So they're going to be stored in the areas that are, such as the visceral, or areas that are not, like the muscle and the liver and that type of thing. So again, it's the size of the fat cell that really dictates, and the unhealthiness of it dictates where it's going to go in the body. So the majority of it now is going into the visceral. I'm going to further explain this, so kind of all comes together. But this is also really important to know too, and we've done whole presentations on this, but blood sugars are all over the place. People have no idea, what's happening on a daily basis. We're obviously not supposed to have spikes all day long. But again, I think just really encouraging you talking with patients about not only just, checking blood sugars, glucose levels once a year, going a step further and making sure patients are getting, or you recommending tests to get insulin levels checked, because it tells a whole different story when a patient's trying to, get metabolically healthier and lose weight. All right, so now we're going to talk about why visceral fat cannot be used for energy. So again, it's a fat cell that is getting larger. And so this enlarged, metabolically dysfunctional cell actually will reach its maximum. So it's kind of like a balloon. You can only put so much air into a balloon before it pops. And that's actually exactly what happens to a fat cell. So when the fat cell reaches its max size, it actually is resistant to insulin's fat storing ability, because again, insulin is just now insulin turns on the fat storing mode, right? It is a fat storing hormone. But now these fat stores are saying no to insulin, like, we cannot take any more fat. And so they basically shut down that process. So what happens with the fat cell is it begins to suffocate. And when it begins to suffocate, it becomes hypoxic and it loses all blood flow that keeps it alive. So that's where you hear that, these visceral fat cells produce so many inflammatory markers, inflammatory cytokines. And it does that because the fat cells are in dire straits, right? It is looking for blood flow and it can't get the blood flow because if you look at this little image, you can kind of see, I know it's small, but these are fat cells of a lean person and all these little red things, these are blood flow. So they all have access to blood flow. And then the bigger the fat cell, the farther away they are from the blood flow. So then they begin to basically die. The fat cell will actually die. So it's called fat cell necrosis, causing cell death, more inflammation, and then it can form all different cysts to kind of like find a way to remove itself from the body, but then that creates another whole host of issues because the immune system has to come in and kind of help with that job as well. So hopefully that made some sense of better understanding, literally why the body cannot use visceral fat for energy. Because again, still when I do like research and just different searches, you can search it. It'll say, does the body use visceral fat first, or does it use like subcutaneous? And it always says visceral fat, and it's just not true. Okay, so visceral fat causes so many diseases in the body. The body now is in a chronic state of inflammation. So inflammation is obviously kind of like the root of every chronic disease, and the body is not supposed to be inflamed all the time. An inflammatory response is a very normal process. It's just not supposed to be sustained, right? So when you have an inflammatory response, let's say you cut your arm, inflammation signals to the immune system, the T cells, the helper cells, they all come to heal the injury. Things kind of, immune system does its thing, and then the inflammation calms down. But what's happening now is that the body is in a chronic state of inflammation, so the immune system is confused. This is why autoimmunity and obesity, like there's such a significant correlation with it. So not only do you have inflammation, systemically, I mean, you have gut inflammation. Now everyone is dealing with gut issues. I mean, it's much more than the visceral fat. I mean, it's obviously the food and all of that. But so now your gut's involved, and another whole host of, immunity issues, because 75% of immune cells are in the gut. So pulling it all together, again, so the different fat cells are very, very important. The mitochondria for fat metabolism plays a crucial role. Visceral fat, that's why, we have to know like how much visceral fat a person has, and when they're losing weight, are they losing the visceral, and how damaging it is, so the inflammation, the immune dysregulation, the gut imbalances, and then you have your adrenal issues. The body is in a chronic state of stress. And it's not like, oh, they have 5 kids and they're overwhelmed. No, the body is in a chronic state of stress because of all of the things that are going on inside. So then you ask someone to try to manage more stress, but their bucket's already full. So again, kind of see like the vicious cycle. So this is why telling someone to just eat healthier and exercise more is just not going to work. I mean, it's just not going to work. So now we're going to add in the element of where specific nutrients come into this. But before we get into that, I want to talk about, and again, when Eric and I were putting this presentation together, we really wanted to present it in a way that helped you understand the whole process, because it is a very kind of meticulous process when we were studying this and putting this together. But the ultimate goal for developing like our programs and our weight loss programs was to change the metabolic health of our patients. And we had to get the body to use its own fat stores because that's what it's for. I mean, our fat stores are for it to be used when there's a need, when there's a caloric deficit. But that doesn't happen anymore because again, the body doesn't perceive all of the inflammatory fat cells. All right. So what we know and what we've accomplished is that in order for us to make this shift happen, we had to create an energy deficit. You have to create an energy deficit because if you have adequate calories coming in, then the body's just going to use that for energy. So you had to create a need. We had to decrease insulin and regulate blood sugars. So the diet part of how we create programs is the macros have to be very specific because we want to keep that tight range of blood sugar throughout the day, and we have to start healing the insulin and start bringing the insulin levels down. And those two things alone are now going to start minimizing the size of the fat cells as well. Then there's the other part of mobilizing the visceral fat, using the visceral fat cells for energy. So we had to be able to find a way to get those fat cells mobilized so that the body can actually identify it and it can be moved into the mitochondria. And then the last piece was, because you can break down fats all day long and they can go into circulation. But if you can't get the fats to go into the mitochondria to be used for energy, then it's kind of like just wasted time. So we looked at all of those pieces and we created a program putting all those pieces together, and it all has to happen at the same time. So that's like a really important part because you can't just tell someone to go on a low calorie diet. That won't work. You can't just tell someone to take, carnitine or something like that. It's all of these things all at once that happens during the complete metabolic shift.
All right. You can take a breath now. That was definitely a college lecture.
Oh, okay.
But no, it's great because, and I think that we really got the point across of what we were trying to show is that it is so much more complex than eat less, exercise more. And for each individual person, different things happen at different times that you have different needs. Knowing your patients really, really well is important because then you can customize where their specific needs are. So I am shifting over into the importance of nutrients. And I'm going to just say I was one of those dietitians right off the bat that I believed only food. You don't need any supplements. We get, everything needs to come from the diet. But over all of these years of experience, after testing so many people, on a NutriVal, for example, or even just regular blood work, you can see the extremely high needs of nutrients people need. The RDAs are not adequate for what people are experiencing now. And not only that, but all these other contributing factors. And I'm pretty sure I'm speaking to the choir here about the poor farming practices. So the nutrient content in foods is no longer there, the poor quality of foods, the amount of time it has to travel before we actually get it, the inflammation. So inflammation alone in the body has extreme increased needs for nutrients to help break down those ROSs that our body's experiencing. So the stress can come from the mental stuff, but it's also that stress in the body, the inflammation, and then gut dysfunction. So it's no longer what you put in your mouth. It's now what you can break down, digest, absorb, all of that. I am going to preface on this next slide the importance of, are you able to shift that, Sherry? Okay, here we go. So I'm going to talk about the importance of understanding supplements. So it is do no harm first. We're not just throwing supplements at people. Even the best supplements out there for like antioxidants, for example, sometimes we're actually doing harm if we don't know what's truly going on with our patient. So first, we need to really assess what patients are taking for supplements. And I think they're more often open to sharing with us versus their doctors on what they're taking. But a lot of times people even forget that certain things are supplements, or so it's really getting deep into what they are taking, making sure that they even know why they're taking supplements. I can't tell you how many times people say, oh yeah, I'm taking this, bring all your stuff in. And they're like, actually, I don't even remember why I'm taking it. Or, even worse, like, they were anemic, so they were on iron pills. Now they've been on iron pills for years, and now they're oxidatively overloaded. So it's really like a whole separate job in itself, just managing patient supplements. Then I'm going to go down the route of the brands, the ingredients, the potency. Like, you have to look at how much is in each product. You have to look at all their products together, and are they getting too much? So there is a lot to go over as far as supplementation. And then, the best way to do this is really look at all the medications they're on. Certain medications deplete nutrients, as we have been traditionally taught, but then also looking at labs, asking for additional markers like, B12. It's often depleted for people. I could go into so many nuances about this, but I'm just going to kind of keep going here. And then here's like a source of, sorry, there was one other thing. There's a source of income there. So people will like say, oh, I'm not going to spend $100 on a provider session with you, yet they'll drop $100 in supplements in a minute. So if you really are looking for additional income, setting up a full script account and getting your patients to order through your full script account is a really great added source of income. So if you're looking to expand on what you know and do, supplements are a great way. I will say one other thing, go slow, go low and slow when you work your way up. So always starting at a very low dose and increasing when you work with patients is best practice. Okay, so I could not help but include at least one label of a very common multivitamin called Centrum. And I can't tell you how many patients come in on this product. And I am all about, like I said, food first, and, but I am also about supplements. But when you look at these ingredients, look at this: modified cornstarch, hydrogenated palm oil, red 40, blue 2. I feel like we're getting more toxicity than we're actually getting nutrients out of this product. And it can actually be really hard to convince a patient to switch off of this until you actually turn that label over, help explain all these things, because their doctor is telling them to go on, this multivitamin, and that's what is available to them. So we might actually be causing more issues than good by taking something like this. And, they're often, or can be, certain brands can be owned by pharmaceuticals as well. So you want to really dig in and know the best ones. And that's why I really do like Full Script, because they do the homework for us. They know all the brands, they're all third-party tested, and a really great way to just take that piece out of having to do all the research. Okay, so if your head wasn't already spinning, I'm going to talk about more specific nutrients. And what I want to say before I get into the specific nutrients is these listed here it does not mean that your overweight patient needs all of these, okay? Let's say, for example, your patient has enough chromium in the diet or has enough carnitine in the diet. Adding these things alone are not going to be helpful. We have to go back to understanding our patient and looking at that whole picture. Sometimes we don't have all the data and information. So is it going to be harmful to give a patient, a little extra carnitine? Probably not. But we want to have the full picture before making specific recommendations. So I'm going to talk about a couple of these supplements that can be really helpful. HCA, which is hydroxycitric acid, or you probably know it or have heard of Garcinia cambogia. That is a really well-researched nutrient. It's also found in hibiscus. And when I was doing some research on this, even some gut bacteria produce HCA. So that actually makes a ton of sense, right? Because it's like, how does my body need HCA if I never ingest this food normally? Well, actual bacteria are making this. So if we have dysbiosis or issues with bacteria, then we're not making what we need for this. So HCA, for example, it inhibits the enzyme that turns the carbohydrate food we eat to fat. So it stops when we eat a carb, it stops the conversion. So it's not going to get stored as fat when you eat that. Chromium, it boosts insulin function. So you've probably heard of chromium being in some different blood sugar regulation supplements, pretty common. L-carnitine, super important for that transportation of fat into the mitochondria. That's what Sherry was talking about. Like it can break down, but if it can't get to the mitochondria, it's pretty pointless. And I think about amino acids. So going back to like further testing, I've done the NutrEval test, or even if you do organic acids for the amino acids, you will see people have differing amounts of amino acids. And some people really have high needs. One, either they're not eating enough protein, but more importantly, they might not be breaking down the protein into the amino acids so that they can get into the body. So we might have increased needs there. You may have heard of forskolin, another nutrient. This one's really important for that hormone signaling to release fatty acids for energy. L-carnitine, this one stimulates brown fat activity. You know, if you've learned nothing else, like we want more brown fat, it really helps. So also with mitochondrial biogenesis. African mango is another one that's pretty commonly has research on it. And because this one increases adiponectin. Adiponectin can also be tested, and there is a real correlation with adiponectin levels and a healthy weight. The reason is this hormone helps promote fat burning because it increases insulin secretion and it suppresses cytokines. So cytokines are those inflammatory responses and will be high when people have this excess visceral fat. Okay, moving to, we haven't really talked much about nutrients that protect muscle mass. So this can be that tricky place where we are, and you know, we hear it all the time with the GLPs and worrying about muscle mass. So there's a lot of components that go into muscle mass. So obviously we have to be eating enough protein. We have to be getting movement in our body to have the protein, but there are specific nutrients that are also really crucial during a calorie deficit that we need to make sure are there. So here we're going back to our amino acids, our proteins. L-leucine is one of those, one of the branched chain amino acids. I want to focus on L-glutamine. So this is one that's needed in really high levels when people have leaky gut. This is the preferred amino acid for building the gut lining. So I see this a lot on the testing results where glutamine levels are super high for needs. So we need this to build muscle, but it also aids in that recovery and it stimulates growth hormone. L-threonine is another one. This also stimulates growth hormone. It's also a precursor for protein synthesis. And then betaine. So this is also known as trimethylglycine. So what this does is it helps retain water in the cell so our cells don't become dehydrated. We know cellular water inside and outside the cell are super important for also for things to get in and out of the cell. But it also provides that methyl group when we go from more science going from that homocysteine to methionine. It's a precursor for creatine and carnitine. So very important for energy and muscle health. All right, detoxification, such a huge piece and really important when people are losing weight, especially, you know, we hear all about the GLPs and how patients are losing weight so fast and then all of a sudden it stops. What happens for a lot of people is, yes, they're releasing these fat cells, but with that, all the stored toxins, heavy metals, things like that get stored in fat cells. So when we are releasing fats in fat cells, we're also releasing those toxins. So detoxification becomes even more important while patients are trying to lose weight. Here is a list of some, not all, nutrients that are important. Artichoke is one of them. I also like artichoke as a prokinetic. It helps with motility. So I think of people that, have sluggish bowels, they're already poor detoxifiers because they're not eliminating properly. Artichoke can help with detoxification of fatty liver, but also that motility piece. Watercress can help flush out the toxins because it's a natural diuretic. Milk thistle, I hope you have heard of. This one is, really well studied and linked to helping liver function and liver health. Our liver does so much, and we have to do everything we can to make sure it is optimized. Back to that NutrEval test, ALA is one of those I notoriously see as extra high needs for people. So that is important for, again, liver detoxification. NAC, that is that precursor to glutathione, the master antioxidant. We need, when our body's in a stress state, we need really high levels of glutathione, precursor NAC. During sulfation, so this is part of liver detoxification, we need those sulfur components. So when people are limiting, they're not eating their cruciferous vegetables, their onions and garlic, they're not getting enough of those sulfur containing foods. That can be a problem for detoxification. Green tea, also very well researched for weight management. Some of the big reasons that it's very high in polyphenols. You've heard of EGCG likely, and a component in a lot of different supplements, and it helps reduce that liver inflammation. And then calcium deglucarate, I tend to use this one when I think of hormone detoxification. So estrogen dominance, that sort of thing. What it does is it inhibits an enzyme beta glucuronidase. So instead of, when beta glucuronidase is high, it's usually an imbalance in gut bacteria. And when it's high, it's just recirculating estrogens that were supposed to be detoxified out of the body. So this helps stop that so things can be detoxed properly. So hopefully that was helpful. And again, we don't need necessarily all of these. We need to identify where the patient has dysfunction. And I'm not going to belabor this point too much, but the liver is so important. It's the one that, is producing bile. Bile is so important for fat breakdown. Anytime I see insulin sensitivity, I always look to liver enzymes to see if there's something going on here, because it also has a big role in blood sugar balance. It helps package up and excrete hormones that are supposed to be released. Cholesterol levels, sometimes I actually see cholesterol levels low when we have liver and gallbladder issues. It is doing the processing, the metabolism of fats, proteins, carbs. There's a lot of enzyme activation. If you're taking medications and you have beauty products and you drink water that's unfiltered, you're getting constant toxins in, and it's the liver's job to package it up and get rid of it. So over 500 processes in the body are done by the liver. Whew. Okay. So this is where, with all the information we know, all the research we've done on these different nutrients, what we have done is created programs that are structured with macronutrient content. We support abnormal fat mobilization, so the hard to reach stuff. We support the mitochondria, because you saw how important that is. We work very hard to preserve muscle mass. We don't want to be losing muscle as we're losing weight. We support removal of the toxins in the body, and then mineral electrolyte balance is also super important for that cellular water inside, outside the cell, etc. Okay, so who is not? Sorry, Who
did you want to go through that or did
Yeah, I
that?
just did want to say who this is not for. So I would hope you know, like, we are not trying to lose weight during pregnancy or when they're trying to conceive. I also find it a little tricky with supplements if people have significant gut issues or they're super sensitive to supplements. You know, that's the one thing with supplements is one, they could have a sensitivity to one of the ingredients within one of the supplements. But they digesting or absorbing the nutrients as well? The big thing when we decide, so we also work with GLP patients, the big thing when we decide which approach to take, more of this metabolic or a GLP, patients have to be willing to follow a very specific plan. So we will help explain this a little bit more too, but if they are not looking to make significant changes, eat very clean, this is not the program for them. Or obviously, if there are no metabolic issues to address, which is 2% of people, this program is not for you either. Okay, so we have two main programs that we call these metabolic weight loss programs. This is one of them. We've created two different ones because we have a little bit of different patient types. So at least we're having some customization as to which one is the right one for our patient. So this one has this is HCA lean. It has the HCA in it. It has chromium. It has the carnitine, forskolin, a bunch of B vitamins. And it has a couple other things in it too, but these were the ones that we wanted to highlight. And with this program, you can see the three different supplements there. They go through this on a very specific plan for 30 days. And we tend to use this one for people that we see have blood sugar imbalances. They potentially are active exercisers and really don't want to reduce any exercise, like that's their thing. They potentially even are eating some, overall healthier, but they tend to have this like high stress load. Maybe it's that mitochondria dysfunction that Sherry was talking about earlier, more fatigue, high stress sort of a person. Did I hit that right? Okay.
Yeah. Yeah,
Okay.
we can come back around if we need to.
Okay. HC2 detox. This is for those poor detoxifiers. These are the people that have probably more sluggish bowels. One of the symptom assessment questions I always like to ask is, are they sensitive to chemical smells? That can be a really big indicator of their inability to detoxify. There's a lot of genetic components to that too. So what I really like about this product, if you know about detoxification, there's phase 1, phase 2, phase 3. We need specific things in phase 1 and phase 2. So things can get stuck in the detoxification if we don't have all the right inputs. So this product is beautiful for all of the phases of detoxification. And then we have this blend of African mango, maca, niacin that is really supportive of mobilizing abnormal fat. So it's helping through that whole process Sherry talked about. And then we have a really good source and form of absorbable mineral and electrolytes to help with the whole shift. Okay, so I'm going to talk. We have probably mostly dietitians. I'm sure you're wondering a little bit more about the meal plan. And I do want to back up and say, like, these are the programs we were doing prior to GLPs. Like, we have been doing this for 11 years. And we've finessed the diet plan, but it really hasn't changed much at all since we've started and have had just wonderful success. The way these plans are formulated, it is meant to be short term and only while taking the supplements. It goes back to us having all of those components at the same time in order for this process to work. So it is low calorie. We have to create that calorie deficit. It is low fat. And we are not back in the 80s, 90s when, we go to those low fat diets and that's the way to lose weight. That is not what we're talking about here. The way we're doing this, because of the nutrients and the lower calorie, you are more effectively pulling your own fat stores. So you are getting nutrition from your own fat stores. We do keep out grains. you know, a lot of people, when they are in this poor metabolic state, they have a lot of foods that are causing them inflammation. So in the short term, again, not long term, but in the short term, we completely remove grains to help reduce inflammation, reduce that blood sugar, and improve insulin. Um, it is very clean eating. We do not have any processed foods in this. Again, to reduce that toxin load, we're trying to make it easier for the body to shift and lose weight and reduce the inflammation. And then super important as well, adequate protein all throughout the day to protect the muscle. So you can see here as a sample meal plan, we prefer the 3 meals per day, and egg wrap, for example, with spinach, sun-dried tomatoes, and some raspberries, chicken breast over salad, greens with carrot and peppers, and then shrimp with roasted broccoli and cauliflower. So that would be like an example of what a patient would follow in a day. Okay, so if we have not said this enough, I hope we get this through on this one. We created this graphic to really help people understand what is happening and why all of these pieces are coming together. So we have those nutrients in there. And I don't think we really talked too much about this piece, but there are components to the 2 programs of curbing hunger as well. I think that's one of the huge reasons people love the GLPs, because their hunger is so reduced. These nutrients and supplements also help reduce hunger levels, but most importantly are mobilizing those fat stores. We follow a very strategic, clean eating plan. We do follow our patients closely, weekly actually, to help with the coaching, the lifestyle, anticipating things that are coming up, that sort of thing. So with those things together, we are getting to those visceral stores. We're using your fat stores for energy plus the food, and able to very effectively reduce visceral fat. What I want to say from this is this isn't a short-term fix. Like if they go back, like if they go off the diet and off the supplements, they're not going to gain the weight back. What we are doing is shifting their metabolic health. We're switching. We're not having as many of those white adipose fat stores. We're not having those inflammatory levels, all the things. So ultimately, we're doing something very specific during a program, but in the end, they're left much more metabolically robust. Okay, so I am just going to quickly go through these so you can see these. I know we're almost at time, so I'm not going to like talk a lot about each of these, but I think a picture shows says 1,000 words. You can see after just 30 days, look at her transformation. You can see, you know, obviously there was a weight change, but look at where we highlighted the body fat in pounds. And then we always are watching visceral fat. We have those more extensive composition scales. So we are measuring these things. Okay, so you can see the difference there. Here's another one, 30 days. You can see very little shift in muscle mass. All essentially was pounds of body fat, and look at the change in visceral as well. Here's a guy, no change in muscle mass, and look at the significant loss in body fat and visceral as well. Another woman, she's older, so you know, any age you can really go through these different programs. Look at, again, you can just see here, she did lose a little bit of muscle mass. So not everybody's perfect. Not everybody is, you know, following exactly what we recommend, but you can still see the majority was body fat loss.
Well, and another thing to point out, and we talked about this in our last, like one of our webinars, that sometimes there's fat infiltrated in the muscle. So when you know, our composition analysis doesn't decipher, you know, like the infiltration of the fat. So if they're having such significant fat loss, some of that muscle mass could have been some of the fat. But yeah, I mean, sometimes people will lose a little, and it's all about looking at kind of like where their muscle, do they have adequate muscle for their body as well.
And this patient actually lost more fat than total weight. She actually gained some muscle and lost additional weight over the total pounds on the scale. So again, another reason the body composition scale is so nice to have, because you can see what patients are actually losing. Okay, so I will say, Sherry and I have done every single program that we have. We think by us doing this, we are the best at providing and supporting our patients through this. So what we wanted to do is actually offer a group program for providers. And we tried to think through some of the different questions or things that come up. So potentially you could be a provider that doesn't need to lose any weight. If that's the case, you could always facilitate it for a close family member or a close friend, but you would be the one going through the program to facilitate for them. If you only had 5 pounds to lose, you would follow the program up to the 5 pounds lost. And then we would put you on what we call our transition diet. So there's definitely ways to do this, but we highly recommend you starting with experiencing the program for yourself.
Yeah, and that was like the whole approach, because we've been talking about our metabolic weight loss programs for a while, and we had just some dietitians actually go through it, and it was just so eye-opening for them. They're like, I would have never known all of the little nuances and details to it unless, unless I went through it. So, all
So
right.
we do help people one-on-one, but we also offer group programs. So as you know, group programs, you can have more people in less time. You can reduce the price so more people can go through it. So it's a really nice, effective way. It's a 30-day program. There's a weekly live support group that's also sent out and recorded. We again follow that very specific diet plan and supplement plan. The average weight loss, and I know this might just be a surprise, but please be open to how this all works. The average weight loss is 10 to 20 pounds. It's really significant. 100% online, and the supplements are included. So we are offering this program to you guys for $217. It's the lower price than we've ever given to any of our patients. Essentially, we want you to experience this. It would be weekly support sessions all the way through it. You would get meal plans, recipes, grocery lists, help with navigation through the struggles that we've seen people have over time. Like I said, we've done this for 11 years now, and pretty much have heard everything. And the whole point of doing this and having you guys do this is we want you to be able to offer this to your patients. So we also, I don't know how many have been following us here, but we have a GLP course that we've had many dietitians and weight loss providers go through. We're still doing our GLPs, but now we're also offering our metabolic health weight loss programs as well. So we want you to experience it first, and then you can also go through and have all of our content, everything we've done. And if you've seen our other stuff, it's very robust, all the patient handouts, all the recipes. It's all turnkey for you. So why sign up now? I mean, a lot of us, even us providers, we probably could use some metabolic shift and support. And why not? This be a great way to experience it for yourself. And then most importantly, so that you can offer this to your patients. I mean, even if you would document you in the beginning and the end, how easy of a sell would that be to your patients then to say, hey, I did this, something worth trying. But it's very dramatic, very easy to shift metabolic health overall, and having another option in your toolbox. So like I said, not everybody wants to do a specific program like this, but a lot of people do, and they want a big change and they want to actually improve their health. This is a really great way and in short term. Like I said, it's all turnkey, and then you can offer this individually or as a group.
Yeah, and I'll just mention too, so these are 30-day programs. We offer it in various ways with our patients. So some patients will actually do 2 rounds consecutively. We typically we don't recommend doing it more than 2 rounds. A lot of patients will do it like every 3 months, they'll do it throughout the year. So everyone is different. It's not like, oh, they just do it one time and then they never do it again. I mean, this is their metabolic reset that they use to keep moving in the right direction. Oop.
Yep.
Okay.
So here are the more specific details. You can see you can sign up by the 12th. We do have that early bird pricing for you right now. We will have those weekly live sessions. We have one session the week before the program starts. So we get you all acclimated to how to take the supplements, what the diet is, and get those products all mailed to you. On the 20th of October, you'll start the supplements and the diet. We'll have those weekly sessions on Mondays at 12 noon. We will also have them recorded. And then it's the 30 days. So it would end November 16th. And then we're going to have that training program available if you want to start using that with your patients. So you can see the program and then the shipping, and we will get more details out to you soon.
Okay, I think we have some questions to go through here.
Yeah.
All right, how do you want to do this?
The question about modifying for vegans. It's a good question.
Yeah, so I'll give my insight on that. So this program is really difficult for someone that doesn't eat animal protein. It's possible, but we're not super big fans of like the vegan meats, like Impossible and all of that. I mean, there are some sources that and like tofu that you can do it. We've had some people do it, but it's challenging. So I don't know if you have specific questions. It's just, yeah, it's not ideal, but it's possible. Erica, just to go back to this one, are you familiar with IM8 supplement?
I've heard of it. It's a brand that has to do with gut health and energy and all this stuff. I think there are so many things out there of these sort of supplements. I would go back to the idea of make sure they're third party tested. Um, I'm looking this one up really quickly, and it has a lot of superfoods in it. So there's a lot of like turmeric, tomato, cherry, grape skin. It also has super mushrooms in it, MSM. So a couple things. When you have an all-in-one like this, you're like throwing everything at the wall and seeing what sticks is kind of my opinion on some of this. Some of this though, okay, I'll have like two sides to this. One, if you're only going to have a patient willing to take one thing, this might be super helpful because you're getting kind of that all in one, for example. But not all of us need all of it. And there are a lot of people with food sensitivities, and they potentially will have an issue with certain nutrients in here. I do like that this one has the more absorbable forms of the B vitamins. So it looks like a nice form of a lot of these nutrients. But like I said, sometimes we have to better adjust the the not everybody needs all of these things, I guess, is what
Yeah,
I
I mean, and that's what I was gonna say. I mean, what is the goal? Like, what's
yeah,
their goal, right? If their goal
yeah.
is, and again, I don't really know, I'm not familiar with like what the target audience for IM8, but I think it's kind of like if it's, just supplementing or, if it's weight loss or, what have you, I think, really digging into that a little bit more. But okay, let's keep going through these because there's quite a few.
Yeah.
Can clients stay on their statins while doing the program? Yeah, we don't recommend clients go off of any medication. We definitely are talking about medications and encouraging patients to have conversations with their doctors because a lot of the lifestyle drugs are part of the problem, right? So if they're on some type of, PPI, statins are destroying the mitochondria. But again, they can stay on all of their stuff. But again, it's really having a conversation about, okay, let's look at your state of health. If you've lost 20 pounds, like, can you start weaning off of certain things? That type of thing.
Yeah, I will say we will watch if people are insulin dependent. That's one that has to be more monitored. We've also seen huge blood pressure changes in short amounts of time. So it's important to know what they're on. But yeah, we don't, obviously, we're dietitians, we're not like managing their medication.
Yeah.
The scale we use is the in-body scale. Can you follow the program if you're breastfeeding? I would not recommend that. You don't want to be going on a very specific program like this while you're breastfeeding. I would suggest after breastfeeding.
Yeah, I think, again, I think it's just no matter what you're doing in life, like nobody recommends somebody that, is either pregnant or breastfeeding. I don't like, healthy eating and healthy supplements, I can't imagine would be worse off than someone who's eating McDonald's every day. But again, I think just for the sake of the right thing to do, definitely waiting till, you're done breastfeeding. Have you done long-term results study? So 5 to 10 years out, we've been, we can only do so much as a small business. So we have not pulled data as far as, specifics of like people that did it 5 years ago and then brought them in 5 years later, that type of thing. But what we do know is that we change people's metabolic health. I mean, without a doubt. And so what we typically find is that people are on their journey, right? Weight loss is something you work at your entire life. That it is not something that you do once and then you're done, obviously. I mean, a lot of people know that. So we'll get people that still come to us that sporadically, like we do a group program 3 times a year with all of our patients. And so we have a very large group that will do it 3 times a year. So, and patients they're on the progression of their journey. And we see that it absolutely gives them, for the first time, the opportunity for them to actually lose weight, feel good. They never thought they could feel like it. So, yeah, I mean, I know that was like super long-winded. We just don't have like the data points, but subjectively, we see people are doing really well afterwards. I don't know if you have anything to add about that.
No, that's good. And if we're not seeing these patients back over the years, we hope that it's because they're still doing well. But also, like, we can't control what they're doing between times of seeing us either. So I think it'd be kind of hard to do a study specifically
Yeah.
with that.
Okay, so there's a question, how does this compare to fasting mimicking diet? So we haven't like looked at the markers of fasting while on this. We don't, yeah, I mean, wait, let me read the question. How do you compare the fasting? So fasting mimicking is probably similar number of calories, but their diet is around, is created around, ensuring that none of the nutrients, that take you out of the fasted state are being elevated. So we don't monitor that. We're all about kind of the fat part of it, the fat mobilization and fat loss. So,
I will say though, I mean, we are all for the fasting mimicking plan. We
yeah.
created our own fasting mimicking plan. I think there's definitely a place for it. But I think it's helpful to get people in a little bit of a better metabolic state before you do the fasting mimicking. I would actually even say it's probably like more difficult on the body to do fasting mimicking. Like, start with the metabolic health program and then go to that.
Well, yeah, and you're doing fasting mimicking. Well, I suppose, I mean, the program that came out was the 5 day prolong, but
Yeah.
I don't think you would do fasting mimicking for 30 days. I mean, maybe you could. It's just,
Oh.
yeah, I don't know. It's different. We don't know, to compare the 30 days. We have never looked at that and how much fat loss and things like that. So it's just, yeah, it's hard to answer that question. How will you know which supplement option to do? You can't go wrong with either one. Once you, if you have a question, if you have additional questions, you can schedule with one of us. We can kind of walk you through it. But typically, it's kind of like HCA lean is awesome if you are someone that wants to lose weight and you just have been an exerciser your whole life and you want to continue to do that because it allows for a higher level of exercise, whereas HC2 is more for the person that just horrible habits, probably maybe some elevated liver enzymes. They probably need a very, very good detox. They need to support the liver more during the process. That's going to be the program for you. But again, you can't really go wrong. We kind of love HC2 the most for our patients just because the majority need such such a detox, as they lose weight.
We haven't talked about this much either, but we will sometimes, sometimes people will be done in 1 month, but other people have 100 pounds to lose. We will do 3 consecutive 30-day programs for people, then have them go off for a period of time. So there's the opportunity as well, depending on how much weight to lose, like with the amount of time people are on these. And we have a question on if they've started a medication to manage cholesterol, can you help them wean off of it? I cannot tell you how many people have stopped taking their medications related to blood sugar balance, to cholesterol. I mean, you name it, blood pressure, that have no longer needed these things. And that's why we say it is a metabolic shift for the body. It's putting yourself in a healthier state. You're no longer having these elevated labs and dysfunction.
Okay, so there's a question. I've seen some information online where HCA has caused liver toxicity, possibly liver failure. Thoughts? Also, info I've read said it had minimal positive effects. Would this be because a calorie deficit is essential? I haven't read anything on the liver toxicity part. You have to understand, and then again, we try to reiterate this, like this is all of those things happening at once. So this is the synergistic effect. We're not just giving, one thing, we're not just creating a calorie deficit, we're getting the body to be metabolically optimal during the process. So that's why we're getting the results that we're getting. So I don't know. Again, I don't know if I answered the question. I mean, I would, you know, I guess we could look into HCA. I've never heard anything about that and liver issues, but
I
yeah,
would also say, quality of the supplement. You know,
yeah, exactly.
what was the source of it? And if someone already has fatty liver and is taking a ton of things, this could be one more thing, right? But I think most importantly, like what Sherry said, is HCA alone is not going to do the trick. It's not this miracle product. It's the combination of all these things that's going to make a difference. And I like the point about, could that calorie deficit be part of the problem? So all of a sudden they're losing a ton of weight fast. It's an overload to the liver, which is already probably taxed. Definitely could be a contributor.
Hopefully the question about the where to sign up, you see the QR code that we have posted right there.
I'm gonna put it in I'm gonna put the actual link in the chat as well, just in case, because I run into that problem too. I'm like, I'm on my phone. How do I do a QR code?
Okay, that would be awesome. I'm gonna answer this one quickly. Have you seen cholesterol changes, like you just mentioned regarding blood pressure? I mean, almost instantly, almost instantly. And again, high cholesterol is usually from inflammation in the body. So when you can address the inflammatory response, the inflammation in the body, cholesterol goes down almost instantaneously, and you clean up the diet. Is there a quiz to help determine which of the two? Um, we've created so much stuff. I don't know if we have something.
So we have like a side by side of which one to choose. That's one of the things we have in our provider training to help you guys decide. We dig into all these nutrients, we go into nuances, anything that people are struggling with. So that's part of it. Like Sherry said before, you cannot really go wrong. A lot of people will, some people even switch from one to the other. I always suggest starting with detoxification if you have any sense that you need that. So HC2 would be, I guess, if you're really trying to decide which one.
Yeah, you really can't. Okay, if virtual, how do you use the in-body scale? What model? You actually can use a home in-body scale that is a pretty close replica of the in-body 570 because we use the in-body 570. And for our virtual group programs with patients, some patients will choose to buy the home body comp, which is the H30. So if that's not an option, then you can search local in-bodies in your area and like a gym, you can, pay like 25 bucks, 30 bucks to go in and do it like before and after so you can measure all your body comp while doing the program. So the answer is no. I don't know. I don't know what that one was.
You answered it before.
Oh, okay. How do you find your patients do on such a low fat when it comes to satiety? All right. This is so key. And again, it's really hard for that's why we just want people to do it. We are getting your body to use its own fat stores. Patients are not, they're not hungry because the fat is being mobilized and fat is what communicates to the brain. It is total satiety. So you won't see that. What I will say is patients definitely miss fat. Like you miss the consistency of it without a doubt. But during this program, start of the fourth week, we start to add in fats to the diet. So it's really only like 3 weeks where you're low fat, and then we start adding fats, and then you normalize into normal eating. But people that are ready for this, they've set that expectation. So yeah, again, people they'll miss it, but they're seeing all the results, and that's more important at that time.
I will say too that we incorporate some MCT oil, if you know what that is. So it's medium chain triglyceride oil, so that anything related to, we keep the gallbladder going, we keep some sense of fat in there as well. So there is a
Yes.
little bit, and
A
there's
little
some
bit.
fat in lean proteins too. Like it's not completely fat free. We're not like trying to remove every possible thing. It's just lower.
Yes, exactly. Exactly.
These were great
Wow. Well,
questions.
those are amazing questions. If you guys have, I mean, we'll be sending out information. I mean, you can reach out to us if you have any further questions about kind of how this process works. And